You or someone you know has erectile dysfunction and found out, read, or heard about the penile prosthesis or penile implant, and not only found out there are different types, but also different companies that make these. When making that decision, you want to make sure you get the best implant for you. For this reason, I decided to make this video and finally talk specifically about the difference between the AMS 700 and the Coloplast Titan penile implants. Hello, my name is Dr. Jonathan Clavell and I'm a urologist specialized in men's sexual health and penile implant surgery in Houston, Texas. Today we will dig deep into what's the difference between the Coloplast Titan and an AMS 700 inflatable penile implant. But before we talk about the differences, let's talk about what makes them similar. The AMS 700 inflatable penile prosthesis and the Coloplast Titan are implants that are mostly made up of strong polymers that allow the body to accept them without creating an immune response. The AMS 700 implants have silicone and the Coloplast Titan is made of Bioflex. Both polymers are chemically inert or inactive, and the body treats it as a foreign object. Once inserted, a surgical capsule or shell forms around the implant, which helps the body protect itself and not create an allergic reaction to it. This allows people to tolerate these implants very well. They both have three components: the cylinders, a reservoir, and a pump. All three components are inside our bodies, therefore no one will be able to tell you got something in there. These three components allow a man with erectile dysfunction to be able to have full control of their erection. How? Every time you want to have sex, you can manually squeeze on that pump to get fluid into the penis to produce an erection on demand. Now let's dissect into what makes each implant unique by looking deeper at the components. First, let's talk about the reservoirs. The AMS 700 implant has two different reservoirs, the spherical reservoir and the concealed reservoir. The spherical reservoir is surround and should only be used when placed in the space of retzius or retroperitoneal space deep into your pelvis. The concealed reservoir, on the other hand, remains somewhat flat like a pancake, even when maximally filled, and gives us the ability to place it underneath the muscle deep into your pelvis. And for big guys with a big belly, the concealed reservoir can even be placed underneath the skin without being noticed to the naked eye. Therefore the name conceal. The Coloplast Titan has the cloverleaf reservoir. This comes in two sizes, the 75 ml and the 125 ml. So when partially filled, these reservoirs are compressed like an accordion, which allows it to be somewhat flat, and when fully filled, the Coloplast reservoir can get round like a ball. You might wonder, but what if I have a big penis that requires a lot of fluid? Am I gonna feel it? Well, one of the great things about these reservoirs is that even when they're placed underneath your abdominal muscles, most of the time your abdominal muscles are stronger than the reservoir and can push the reservoir deep into your body. Therefore, most men are not able to see or feel the reservoir after they are healed from the surgery. The Coloplast Titan's lockout valve is located in the reservoir as opposed to the AMS 700 implant that has it in the pump. Thanks to that lockout valve, the reservoir can be placed in either underneath the abdominal muscles or deep into the pelvis. The lockout valve prevents the implant from inflating on their own, what we call autoinflation. Now let's talk about the cylinders. Let's first start off with the AMS 700 cylinders. As of 2022, the AMS 700 has three different cylinders, the CX, the LGX, and the CXR. All three types are composed of three different layers: an inner silicone layer, a middle layer that has a piece of cloth-like material called Dacron lycra, and an outer layer of silicone. This three-layered cylinder is a very sophisticated design that allows a man to feel extremely comfortable in both the erect and the flaccid state. If you're looking for the most comfortable implant in a deflated state, the AMS 700 is the way to go. The risk of what we call dog ears is very low with the AMS 700 implants. Moreover, the outer silicone layer in the AMS 700 implants is impregnated with two antibiotics, rifampin and minocycline. I will repeat that just in case you didn't catch that. The outer layer of the AMS 700 implants is impregnated with antibiotics. This outer antibiotic-coated layer, called inhibizone, is what revolutionized the market years ago and helped us surgeons keep infection risks very low. Once implanted in your body, this impregnated layer of antibiotics slowly delivers antibiotics to your tissues for days and prevents men from getting an infection after the surgery. As mentioned before, the AMS 700 has 3 different cylinders. So CX, LGX, and the CXR. The CXR are strong, narrow cylinders that are used for men with narrow or extremely scarred down corporas. The LGX and CX cylinders are used in larger, wider corporas. What's the difference? Well, the LGX cylinder can theoretically expand in both length and girth, but the CX can also maximally stretch the inside tissues with this controlled expansion while providing more strength. The CX cylinder is a stronger cylinder than the LGX. Therefore, if you have Peyronie's disease, history of priapism, scar tissue, or fibrosis, and you're planning on getting an AMS implant, your surgeon might prefer to use the CX cylinder and not the LGX cylinder, as the LGX might not be the cylinder that's right for you in those specific cases. How about length and girth? The AMS cylinders come in increments of 3 centimeters, from 12 centimeters all the way up to 24 centimeters. When it comes to the LGX specifically, the longest LGX available is 21 centimeters, while the longest CX cylinder available is 24 centimeters. Which size you will need depends on 2 things: the total length of your penis and the difference between the distal or outer measurement and the proximal or inner measurement of your penis. In terms of girth, these cylinders are able to expand up pretty much to the size of your penis. Now, how about the Coloplast cylinders? The Coloplast Titan is made up of a very strong polymer called Bioflex. Bioflex is a strong polyurethane that allows for girth expansion while providing more axial rigidity and increased gravitational resistance, making it ideal for patients with fibrosis or scar tissue secondary to Peyronie's disease. The Bioflex material is found in both the Coloplast reservoir and the cylinders, and it is such a strong polymer that me personally, I've never witnessed the Titan's reservoir or cylinders break or fail. By having a stronger polymer, the Titan implant may also feel stronger during the erect state, which, as you may imagine, is what many men want. The Coloplast Titan is a strong implant. That strong polymer, though, sometimes may cause some men to feel the implant inside their penis during the flaccid state. I will repeat that. If you have a thinner penis or one with less girth, you might be able to feel that you have something in there, and when the implant is deflated or flaccid. This is what some call the dog ears. When the implant is deflated and it folds outside of your body, you may feel the edges of that fold. In most occasions, these dog ears are mild and don't cause any problems. Most men do not complain about the dog ears. However, if you have dog ears that are sometimes uncomfortable, just give the implant a few pumps and that may take care of the problem. Regardless of the dog ears or not, if the implant was properly placed, when the implant or penis is fully erect, you will have a very natural erection that can get as strong as a bull and be very natural. If you're now thinking, well, if the Titan is stronger, my erection will be stronger. We need to remember what I've discussed in our cycling video. In most occasions, what determines the hardness of the erection is not the implant, but your tunica albuginea. Also, when it comes to strength, research cadaveric studies have shown that the AMS CX, not the LGX, but the CX, has comparable performance when compared to the Coloplast Titan. When it comes to antibiotic resistance, the Coloplast cylinder does not have the inhibizone antibiotic coating that the AMS 700 has, but has a different and unique hydrophilic coating that is able to absorb antibiotic aqueous solutions. Hydrophilic means that it has affinity to water or liquid. If the antibiotic is liquid, it will stick or be absorbed by the implant. And what makes this implant unique is that it allows a surgeon to choose whichever antibiotic solution he wants to use. Before the surgeon will decide which antibiotic is best for you, and as soon as that implant is opened up, it will be soaked in that antibiotic solution. The hydrophilic coating will absorb that antibiotic, and the implant is then placed inside your body. Regardless if it is the AMS 700 inhibizone or the Coloplast hydrophilic coating, both coatings allows us surgeons to decrease the risk of infection to almost 1%. How about sizing in the Coloplast? Well, the Coloplast has 2 types of cylinders: the narrow-base cylinders that are for men with narrow corporas, and the Titan cylinders. The Coloplast Titan come in increments of 2 centimeters all the way up to 28 centimeters. And in theory, the Coloplast Titan currently offers the widest cylinders in the market. Why did I say in theory? Many men believe that the Titan will add girth to their penis, and most of the time, that isn't the case. Why? I've described this in previous videos, that what determines the girth is not the implant, but your tunica albuginea. If you've always had a penis with 5 inches of girth, do not expect these cylinders to provide for a 6-inch penis in girth. However, if you have lost girth, sometimes these cylinders can help you recover some of that lost girth, but there's no guarantee of this. Now let's actually inflate both the AMS CX implant and the Coloplast Titan implants right beside each other. For reference, the cylinder on the left is the Coloplast Titan and the one on the right is the AMS 700 CX. Both have 18 centimeters in length. As a baseline, the Coloplast cylinders look wider than the AMS, but let's see what happens as we inflate them. As you can see, the AMS 700 cylinder almost catches up in girth with the Coloplast Titan. Putting one beside each other, they might look similar, but Coloplast still has a slight edge. Let's look even closer. The circumference of the Coloplast Titan upon full inflation is close to 7 centimeters, while the AMS 700 is about 6.5 centimeters. However, again, when you put them one beside each other, they look very similar when it comes to girth. As you can see, both implants are able to expand quite a bit, and the difference is minimal and really not that noticeable. Now let's talk about the pump. I believe the pump is what's most important when it comes to deciding which implant is best for you. Why? This is the part of the implant which you will be interacting with on a daily basis. The AMS implant currently has the MS pump. MS stands for momentary squeeze. As you can see, the pump has a bulb at the bottom and a rectangular block with a semi-prominent button in the middle. This design allows for men to be able to easily identify how to both inflate and deflate the pump. The Coloplast Titan has 2 different pumps, the one-touch release pump and the Genesis pump. The Genesis pump has a smaller profile with a small bulb to inflate and 2 small tabs at the top that you need to press and hold in order to deflate. The one-touch pump has a small bulb and a small flat button that you press and helps the implant deflate. Now, what are the key differences? The one-touch pump has the advantage when it comes to inflation or getting the penis hard. Why? It is softer than the current MS pump. The Coloplast Titan's pump is easier to inflate. However, the MS pump has a sophisticated design that makes it easier to deflate. How so? 2 reasons. Number 1, the button on the MS pump is more pronounced, which makes it easier for you to find. And number 2, the pump vibrates when you press the deflate button, which lets you know when it is deflating. Therefore, if you want something that will be easier to inflate, Coloplast Titan has the edge. If you want something that will be easier to deflate, AMS 700 has the edge. Regardless, almost all men, regardless of age, are able to both inflate and deflate either implant with minimal difficulty. If you have dexterity problems, arthritis, problems with sensation, remember you will be working with the pump by feel. So discuss with your surgeon which pump is best for you. Now, let's summarize. Both implants have 3 components. Both implants expand the penis. Both implants are concealed within the body. Both implants have some type of antibiotic resistance against infections. Both implants have specific features that make them unique in the market. Both implants are durable and great devices for men with erectile dysfunction. The Coloplast Titan has stronger Bioflex material that has the advantage of being wider, but the disadvantage of sometimes being a little bit more noticeable to palpation. The AMS cylinder has 3 layers that allows it to be softer to feel and touch during the flaccid state, with the disadvantage that if one of those layers break, the cylinder can leak. The Coloplast pump is somewhat smaller and easier to inflate, while the AMS pump is easier to deflate. However, most of the time, it all depends on the individual. Most men are able to easily both inflate and deflate with some practice. And as you saw in this video, both implants are great and fairly similar. Which implant benefits you is something you need to discuss with your surgeon as an individual. When I am evaluating my patients, I take age, comorbidities, and dexterity into consideration, but most importantly, two things: their specific anatomy and their personal preference. I usually tell my patients that this is like deciding between two luxury cars. Let's say choosing between a BMW and a Mercedes. Most men will be happy with either one, but there are a small number of individuals that would prefer the specs of one versus the other. Regardless of which implant you get, remember one thing: almost no one will be able to tell that you have an implant. Erectile dysfunction will soon be something of the past, and you will be able to get a strong natural erection. I wish you the best of luck. And if you found this video helpful, be sure to hit the like button below, share it with others, and consider subscribing to our YouTube channel for more content. If you're thinking of getting an implant, call us. I would be honored to be able to help you. See you next time.